Namaskar, hello and a very warm welcome to our webinar series Listening to Learn, जिसे हम हिंदी में कहेंगे सुने और सीखें। आज का हमारा ये जो कार्यक्रम है उसका 41वां एपिसोड है और आप सभी का एक बार फिर से स्वागत करते हैं। हम इस इम्पॉर्टेंट प्रोग्राम को, इट्स आउटरीच प्रोग्राम को देख रहे हैं हमारे माध्यम से, जो कि है यूट्यूब चैनल NCERT ऑफिशियल। आप दुनिया में कहीं पे भी हैं, कहीं पे भी प्लेस्ड हैं, आप हमें देख सकते हैं, सुन सकते हैं, हमसे बातचीत कर सकते हैं और साथ ही साथ हमें आइडियाज़ भी दे सकते हैं। मैं हूं तन्वी खुराना और अगर आपके पास कुछ भी आइडिया है जो आप हम तक पहुंचाना चाहें तो आप हमारे माध्यम से, जो कि हमारा यूट्यूब चैनल है, जल्दी से भेज दीजिए। 11 बजे तक हम इस कार्यक्रम के साथ आपके साथ मौजूद रहेंगे और बहुत सारी बातचीत होगी। Our today's topic is Biosecurity, Threats and Control, यानी कि जैव सुरक्षा, खतरे और नियंत्रण। We have a special guest with us and we also have our coordinator of DESM, that is Department of Education in Science and Mathematics, NCERT, in our studio. So they are going to answer all the queries you have in your mind. But before that, let me tell you, no matter where you are, you can reach out to us. This is an important program. You know what? It's for everybody and it is specially for the Indian diaspora. And once in every 2 weeks, we come here and discuss one of the topics that's related to science. 1 साल से ज़्यादा हो गया हमें इस प्रोग्राम को ऑर्गेनाइज करते हुए और हमने बहुत सारे साइंस रिलेटेड टॉपिक्स ऑलरेडी डिस्कस किए हैं, जैसे कि विंड टनल, जैसे कि मेडिसिन, जैसे कि बैटरी मैन्युफैक्चरिंग इन इंडिया एंड इवन सॉइल वाटर क्वालिटी मैनेजमेंट और भी बहुत सारे। ऑलमोस्ट जितने भी साइंस रिलेटेड टॉपिक्स हो सकते हैं पॉसिबल, वो हमने डिस्कस किए हैं, पर अभी भी बहुत लंबी लिस्ट है और बहुत कुछ बाकी है डिस्कस करना। इसीलिए आज का टॉपिक है बायोसिक्योरिटी। But let me tell you a little bit about biosecurity. So, biosecurity generally refers to the practices designed to prevent, reduce or eliminate the introduction and spread of diseases. अब ये diseases सिर्फ जानवरों को नहीं बल्कि plants को भी हो सकती हैं। और कौन सी वो infectious diseases हैं जो हो सकती हैं? That's biosecurity. उस रिस्क को, उस ट्रांसमिशन के रिस्क को कम करने के लिए हम आज बातचीत कर रहे हैं। कंट्रोल पे बात करना बहुत ज़्यादा ज़रूरी है और थ्रेट्स भी सुपर इम्पॉर्टेंट है। रीसेंट एग्जांपल्स भी अगर आपने देखे होंगे तो आपको आसपास बहुत सारे डिसीजेज नज़र आती होंगी, प्लांट्स में, एनिमल्स में। बायोडाइवर्सिटी, आई बेग योर पार्डन, बायोसिक्योरिटी के कुछ प्रिंसिपल्स हैं, कुछ टाइप्स हैं, कुछ पिलर्स हैं और भी बहुत कुछ हैं जो आज हम इस प्रोग्राम में डिस्कस करने वाले हैं। आज के हमारे गेस्ट से इंट्रोड्यूस करवाने से पहले हम आपको मिलवाना चाहेंगे, जो आप सभी को जानते हैं। हमारे साथ हैं डॉक्टर गगन गुप्ता, जो कि हैं कोऑर्डिनेटर इस प्रोग्राम के। वेरी वार्म वेलकम टू यू सर।
थैंक यू तन्वी, थैंक यू वेरी मच।
सर के साथ हैं हमारे गेस्ट डॉक्टर अर्नब सेन। वेलकम टू यू सर।
Thank you.
So now I would request Gagan sir to introduce our guest and also introduce the topic to all our viewers.
Thank you. नमस्कार दोस्तों, आज के 41वें सेशन में आपका एक बार फिर से स्वागत है। आप इन सभी सेशंस को, जो कि पूर्व में निकले हुए हैं, हमारे NCERT यूट्यूब ऑफिशियल चैनल पर देख सकते हैं। साथ साथ हमारी वेबसाइट ncert.nic.in के इवेंट सेक्शन में जाकर के भी देख सकते हैं। इन सब में, जैसे मेरी साथी तन्वी ने अभी बताया, कि हमने विभिन्न आयामों पर चर्चा की है, चाहे वो मेडिसिन हो, चाहे वो सॉइल हो, चाहे वो पानी हो, चाहे वो जेम्स हों, चाहे वो डायनासोर्स हों, चाहे वो साइंस के दूसरे रिसर्च के इश्यूज हों, चाहे इंक्वायरी से लेकर के हमने सिविलाइजेशन तक की इस सीरीज में बात की है। अभी और बहुत सारे टॉपिक्स हमारे पास हैं। आप लोग अपने सुझाव हमें लगातार भेजते रहिए और आपके सुझाव हमें मदद करते हैं टॉपिक्स को ढूंढने में और लाने में। ये सीरीज आपके साथ साथ चलती रहेगी और आपका सबका साथ हमें मिल रहा है। दोस्तों, इस सीरीज का हमने शुरुआत की थी 6 अगस्त 2021 को, जबकि हमारे साथ कतर से कुछ लोग जुड़े हुए थे और CSIR के साथ, जो कि प्रभास एक पोर्टल है, नेशनल स्टूडेंट आउटरीच प्रोग्राम, जो कि गवर्नमेंट ऑफ इंडिया का काउंसिल ऑफ साइंटिफिक एंड इंडस्ट्रियल रिसर्च के थ्रू चलता है। प्रभास मीन्स प्रवासी भारतीय एकेडमिक एंड साइंटिफिक संपर्क, जो कि शुरुआत की थी जिसकी नेशनल ह्यूमन राइट कमीशन इंडिया ने, और बाद में CSIR ने उसको टेकअप किया और NCERT उसमें पार्टनर है। आज इसके 41वें चरण में मेरे साथ डॉक्टर अर्नब सेन, एक यंग साइंटिस्ट हमारे साथ हैं, स्टूडियो में हैं, जो कि एग्रीकल्चरल साइंस से हैं। इनका मैं आपके साथ सबके साथ आपका तारुफ कराऊंगा और साथ में आज के टॉपिक के बारे में भी कुछ थोड़ी सी चर्चा करेंगे। आज का टॉपिक है बायोसिक्योरिटी, जैव सुरक्षा। आज के समय में जैव सुरक्षा और बायोसिक्योरिटी जैसे विषय बहुत ही रेलिवेंट हैं, क्योंकि अभी पिछले 2 साल अभी हमने महामारी के देखे हैं और अभी भी हम उस महामारी से पूरी तरह से नहीं निकले हैं। अभी हम उस महामारी से निकल ही रहे थे तो खबरें मिल रही हैं हमें जानवरों में, खासतौर से गायों में लंपी वायरस की। आज उन सब बारों में बात करेंगे, उन सब के सामने हमारे सामने क्या क्या समस्याएं हैं और उनके साथ साथ हम किस तरह से कंट्रोल और नियंत्रण कर सकते हैं। आज उन सब बातों पर चर्चा होगी। इससे पहले कि मैं डॉक्टर सेन को आपके समक्ष रखूं, मैं उनका तारुफ आपके सामने करना चाहूँगा। डॉक्टर अर्नब सेन, who is a great close friend of mine, he is the principal scientist at Animal Health Division of the Indian Council of Agricultural Research Complex for Northeastern Hill Region at Barapani, Meghalaya. He is a veterinary doctor by education and by profession. Before moving to the Barapani, Meghalaya, Dr. Sen has been associated with the Indian Veterinary Research Institute IVRI at Mukteshwar, which is now in Uttarakhand. So Dr. Sen has about 21 years of research experience in the fields of veterinary virology and molecular biology, fish processing, veterinary public health and integrated farming, including the porcining virology, morbivirus, vaccinology, thermostabilization of vaccines, studies on multi-drug resistance and diagnostic ELISA development. Dr. Arnab has also worked in tribal farmer outreach, information technology and in digital infrastructure set up in handling a project on monitoring the transboundary animal diseases in the Northeast region. Dr. Sen has been the group leader of the project Knowledge Innovation Repository for the Northeast, popularly known as KIRAN, K-I-R-A-N, KIRAN, that received 3 awards, namely E-India 2014, 2 Scotch Order of Merit Awards by the Center for Development of Advanced Computing CDAC for agro advisory and for tracking SMS services in 2015. Kiran, the project, was also nominated for the Computer Society of India's Nihilent E-Governance Award. He has pioneered the identification of porcine respiratory reproductive syndrome, popularly known as PRRS virus, for the first time in the country in 2012, for which the ICAR RC NEH region won the Sardar Vallabhbhai Patel Outstanding Institute Award in the same year. Dr. Sen has been recognized as international expert for the PPR Global Research and Expertise Network of the United Nations Food and Agricultural Organization, national expert for the use of heavy water for non-nuclear applications, EU, European Union, India expert in the fork of farm, food, that is including seafood, health and well-being, and for many other scientific and research committees formed by the Department of Animal Husbandry and Dairying and Fisheries, Government of India. Heavy water in thermostabilization is the topic for which his work has been recognized, and this work has received appreciation from the Director General of ICAR as well. Dr. Sen has about 75 research articles in peer-reviewed journals, about 60 books and chapters, 65 research reports, around 50 journal articles and 80 abstracts to his credit. आपका स्वागत है डॉक्टर सेन हमारे स्टूडियो में। मुझे पूरी उम्मीद है कि हमारे व्यूअर्स आपके अनुभव का फ़ायदा उठाएंगे। सवाल आप व्यूअर्स आप ज़रूर सवाल भेजें, जैसे तन्वी जी ने आपको बताया, आप हमारे यूट्यूब के लाइव चैट में भेज सकते हैं, ईमेल्स कर सकते हैं। डॉक्टर सेन, इट्स नाउ योर।
Thank you so much. Very good morning to you. First of all, I would like to thank Tanvi Khurana and Dr. Gagan Gupta for introducing the topic. And as all of you know that in the present day context, nothing can be more important than the topic that we are going to discuss today, that is biosecurity. So the title of the discussion would be Biosecurity Issues, Threats and Controls. So firstly, let us ask ourselves a question that why biosecurity is important. Now we all know that infectious diseases have shaped evolution and history of animal kingdom, especially human and animals. So if you look at the prehistoric times or even in the medieval times, it would have been a very common incident to have seen people dying from plague, people dying from smallpox, and a lot of transmigrations have taken place due to these diseases. Lot of native inhabitants and settlers have been affected by these diseases. There has been a lot of loss of human lives. So they are pivotal in determining the course of civilization and history. Infectious diseases are always dynamic and will always continue to influence overall activities of the human being. So the recent pandemic of COVID-19 is a glaring example of that. Now the changing pattern of diseases has been responsible for sustained microbial evolution. Now why this change? Now changes in disease pattern are inevitable. However, we need to be prepared to face this challenge, and this necessitates two very important measures. One is called as the sanitary and phytosanitary measures and biosecurity measures to be in place. Now the traditional definition of biosecurity, which I think was given earlier by Tanvi Khurana, is the level of disease protection and management to prevent or eliminate infectious diseases. So this is the traditional definition of biosecurity. Now if you go for an expanded definition of biosecurity, biosecurity would cover all those aspects relating to food safety, for example Salmonella and E. coli, the presence of chemical residues in foods, example antibiotics, pesticides, transboundary animal diseases or exotic diseases which come across the border. Then there is the fourth aspect, that is intentional infections or contaminations or leakages from labs. Now how to protect biosecurity? So we need to have an effective and integrated surveillance in place. We need to have a very foolproof vigilance in place. Then we have to have prevention and control mechanisms which would be important to tackle any disease right at the beginning. Then the adequate infrastructure to address these issues, and also we need to have preparedness for emergency. Now biosecurity is not a single umbrella concept, so it requires measures at various levels and at different levels. So we should have biosecurity plans in place for livestock or any such product import, for emerging infectious diseases and transboundary diseases. Then we should have biosecurity plans for diseases which are already established, then products destined for export, then for any possible bioterror attack, and also a biosecurity plan for research or teaching labs. So we will deal with each of these topics briefly. Now when we talk about livestock or livestock product import, there is a system which is called as the animal quarantine like system, AQCS, which effectively takes care of all such imports. Now there is a more strict import blanket ban which is prevalent due to the threat of exotic transboundary diseases coming from across the borders. However, the market is opening up and there has to be facility for testing of consignments and exotic livestock. Now the biosecurity plan for emerging infectious and transboundary diseases is that international norms or guidelines have to be followed. We already have contained bird flu or avian influenza. Now there has to be effective implementation at field level which is warranted, because there has to be monitoring at the grassroots level. Then cross field partnership is very important. Then we should have contingency plans for many diseases which are not yet available but has to be in place. Then we have to identify and classify relevant emerging infectious diseases or transboundary diseases into different risk groups. Then these are some of the diseases of livestock and birds, like you could see that West Nile virus, transmissible spongiform encephalopathies is a transboundary disease for India, rinderpest which is eradicated, and if it re-emerges again it is a transboundary disease for India. Then avian, equine canine influenza is I mean a transboundary disease. Then Nipah virus has been reported in West Bengal in men. Then morbillivirus infections in cattle, dogs, marine mammals. Then there is a case of bovine viral diarrhea. So, the list is quite large, and these are classic examples of emerging transboundary and exotic diseases which could affect the livestock and bird population. Then the emerging infectious diseases in humans are the hantavirus renal pulmonary syndrome, then the avian influenza, then coronavirus, SARS coronavirus earlier, now it is the COVID-19, monkeypox, variable Creutzfeldt-Jakob disease, then hemolytic uremic syndrome. So, these are some of the examples of emerging infectious diseases in humans. Now, the biosecurity plan for diseases which are already established are, there are many diseases which are established, there may not be high end diseases, but they cause significant economic losses. So, there is no contingency plan for control or eradication of these diseases apart from control measures at the site where these diseases are encountered, and circulation of virus population virus in the mainstream population may worsen the situation, and semen quality assurance is another important issue. So, now the biosecurity plan for products which are meant for export. So, there is a need for internal certification of livestock products for export. So, there has to be an agency backed with a central laboratory which will test for these products, and usually in the international market products from disease free zones are more acceptable, and foot and mouth disease control program and zoning is a very welcome step. Then more of such diseases like PPR, sheep and goat pox have to be included, and uninhabited islands can be used as disease free zones for breeding livestock for export. For example, in Sundarbans there is an island called Bali Island which can be ideal. Now, when we talk about the biosecurity plan in place for bioterror agents, intentional introductions may differ from natural ones. So, new introductions may differ from past introductions, and mode of delivery may be varied, higher population may be at risk, and we have to develop suitable emergency action plans, because locating such intentional introductions would be a major challenge. Then another biosecurity plan needs to be in place for research and teaching labs. So, we know that laboratory leaks are responsible for many disease outbreaks. So, we have to equip labs with required biosecurity level facilities, then foolproof biosecurity plan is essential, and we have to train researchers before entry for responsible handling of pathogens. Now, what are the challenges and shortfalls with regard to this biosecurity plan? There is no national or integrated plan for biosecurity, and there are substantial gaps in our knowledge, and the knowledge is emerging as we encounter new infections. Current border system is inadequate in excluding many diseases, inadequate ability to rapidly detect and identify many pathogens, and no committed cooperation in terms of quick response in mobilizing the machinery and also compensating the farmers, which form a major challenge in controlling a disease. Then a multifocal large scale attack from the bioterrorism point of view could be overwhelming. Not feasible to have specific tools and plans for all contingencies. However, science, research and education infrastructure has to be tested further and need to enhance basic understanding or the threat perception of these agents. Now, we have to identify and classify the pathogens, we have to see the destructive potential, we have to examine the biology of the pathogen, we have to see the human animal population dynamics, whether there is a spillover or a spillback. Then we have to evaluate the role of wildlife or cross species jumping. Then we have to find out the ways of dissemination and also work on the possible mode of delivery of bioweapons. Now, these are the multiple pathogens, and we will just quickly cover the biology of pathogenesis. So, you can see that here we have three circles which are interrelated. We have the wildlife emerging infectious disease, we have the domestic animal emerging infectious disease, and the human emerging infectious disease. So, each one of them have certain practices which predispose the occurrence of this disease. For example, in wildlife you have translocation as a risk factor, then you have encroachment of domestic and wildlife contours leading to spillover and spillback, and agricultural intensification can lead to re-emergence of domestic animal emerging infectious diseases. Then human emerging infectious diseases are controlled by global travel, urbanization, biomedical manipulation, human encroachment, ex situ contact, ecological manipulation are all factors which bring wildlife, human, animal emerging infectious diseases close to each other and would help in spillovers. Now, the agents and risks to food and water would be biological, chemical, radiological, physical. For example, biological would be bacteria, toxins, virus, parasites. Chemical would be chemical warfare, industrial agents, radiological liquids or solid forms. Physical would be glass or metal. Now, if you look at emerging infectious diseases, there have been 30 in the last 2 decades. 70% of these 30 diseases have been zoonotic, and dynamics favor many more pathogens due to shifting human populations, demographics and behavior, technology, economic development, global travel, microbial adaptation, breakdown of public health measures. Then if you look at the most significant global epidemics or pandemics over the last decade, we have the hantavirus in 1993, the 1994 plague in India, then the Zaire Ebola virus, the influenza viruses, then we had a 1998 outbreak of Nipah, and regular episodes of this virus in the Southeast Asian region, and 2019 COVID-19 changed the entire global perception on the threat potential of a emerging disease or a pandemic. Now, the divided world of 2025 comprises of around 8.4 billion people. So, the first world countries are advanced nations with advances in medicine and food. Then the world 2 would be the middle class, which is undergoing a livestock revolution, and the world 3 are those underdeveloped countries where people live in destitution and poverty, and they are the sources of traditional pathogens. So, now possible biosecurity activity areas involve steps. So, the steps would be both ex ante and ex post. So, ex ante measures include import health standards which are to be fixed, surveillance, pre-border preventive actions to be implemented, border controls such as screening, interceptions and procedures applying to importing goods, then ex post identification, containment, control and eradication of pests on arrival in country and emergency responses. So, all these measures are very important in tackling the problem of biosecurity. Now, resource allocation decision is a very important criteria and a very important aspect of this entire program, because since any measure to improve biosecurity has resource use implications. So, resource allocation decisions are the cornerstone of economic analysis and raise a series of subsidiary issues. How much is it worth promoting biosecurity, taking into account of both the benefits and costs associated with such activities? What measures are best able to provide biosecurity? Then the resource allocation decisions would lead to choice involved in efficiency of delivery and the particular channel of activity, whether it is pre-border, border, post-border and internal. Now, there are 3 very important aspects to biosecurity in terms of risk analysis. One is risk assessment, risk management and risk communication. So, when we talk about risk assessment, is we have to identify the problems, determine the size of the problem and the likelihood of occurrence, because this is not like it will announce itself before coming. So, we have to be on our guard all the time, and the risk assessment is fundamental. Then comes risk management, whereas which is concerned with designing and implementation of prevention and control plan to ensure that biosecurity remains. Then the risk communication, explaining to workers, suppliers, customers and the full management team and to convey that what is the extent of risk which has occurred. So, you can see here that you have inputs like water, feed, labor, wildlife, food animals, ecological factors, chemicals. So, these have different throughputs, processes in terms of management, intervention, disinfection, cleaning, critical control points, treatments, and would lead to the output of reduced hazard and certification and validation with trace back capability, because one thing is that we should know from where the risk has emerged. So, the trace back capability is very important, and these are followed by monitoring at each and every stage. So, this is the risk analysis process. So, risk assessment leads to hazard identification, estimation of probability and magnitude. Then the risk management leads to developing options, selecting that option, conducting a program, evaluating and improving these programs to ensure better control of the risk, and also risk communication to and fro from the team to the client and back is very important. So, the 7 critical steps in livestock biosecurity would be closed herd, vaccination, isolation, source of replacements, then we have to test the replacement, isolate new additions and control farm traffic. So, when we look at the concept of closed herd, no animal enters or comes back to the premises without being monitored. So, the violations would be animal off-site and return, sharing fence contact or equipment, then transporter based spread, no check and testing on new arrivals. The lessons learnt in this would be the FMD outbreak in the United Kingdom, then bird flu spread during epidemics or outbreaks. Now, vaccination is, each farm is unique. When and how to vaccinate is critical. Many farms are not vaccinating when essential. Large percent of farms do not follow recommendations and they rely more on concept of herd or flock immunity. Now, the issues are, we have to stop the signs and not infections, then the entire diagnostic confusion on whether to test and diagnose the samples, then the delayed response, this leads to break in biosecurity. Now, like isolation is another thing, you have to keep away calves from heifers and heifers from cows, keep away people and equipment from cattle, we have to limit wildlife exposures, and we should not share the feed, water and equipment between ill and healthy animals. And the lessons learned would be the cases of tuberculosis in Michigan cattle, similar practice has to be followed in case of poultry. Then we have to have the step 4, that is source of replacements. Bring in animals with known health status, that is herd versus individual tests, then effective vaccination programs, and there has to be a very important aspect comprising to shipments, because we should ensure there are no mixed shipments, then there should be transport in clean vehicles, and we should have a bias towards heifer replacement, and we should get all the health records and information updated, and then half to 2/3 of them use no pre-purchase tests. So, our replacements are never tested and we are not sure about the health status or the disease status. So, this has led to spread of diseases like Jones disease, which is caused by Mycobacterium paratuberculosis. So, this is a lesson learned. Then when it comes to testing of new cattle, we have to test for brucellosis, TB and mastitis. We have to check herd histories, that is bovine viral diarrhea, leukemia virus, Jones disease, etc. We need source herd history and market history, the particular place from where the animals are originating. Then this will be very critical in testing for your brucellosis eradication. Then we have to isolate any new introductions, because there would be a 21 to 30-day quarantine which is mandatory for any new introduction. Then we have to separate them from the other animals in terms of feed, water contacts. Then there has to be medicated food baths, and we have to begin vaccination programs while the animals in quarantine wherever applicable, and ensure good farm practices, and we have to check them daily. Then control farm traffic, because whenever there is an outbreak, and especially in diseases like African swine fever, which is again an exotic disease which was encountered in the year 2020, we have to limit access, fences, gates, locks and signs, separate traffic parking, provide clean clothing at minimal cost, food baths and hand washing has to be made mandatory, then limit contact with people, track traffic separated from herd, use only clean equipment, then decontamination is very important, and the lesson learned would be transmission of avian influenza or bird flu virus. Then there is a increased necessity for collaboration between Southeast Asia or SAARC nations on biosecurity. Collaborations between Southeast Asian nations for creating a biosecure SAARC region is a must, because the Southeast Asian region is a hotspot for emergence of several diseases. So, this is where we have to keep the plan in place to ensure that these diseases are controlled to a large extent. So, there has to be a strict implementation of quarantine at national boundaries of Southeast Asian nations, compatible import-export policy for SAARC nations, biosecurity board for each nation in each SAARC country, then the high security animal disease lab at Bhopal, or National Institute of High Security Animal Diseases, has paid rich dividends. More such laboratories are needed. Then each Southeast Asian nations to have high security animal pathogen labs in the lines of NIHSAD, or establishment of disease database and sharing of information between these nations and also with other nations, that is a med-vet-net policy. Then enhanced laboratory capabilities and expanded surveillance systems. Then research needs to fill knowledge gaps. For example, we hardly know about the emergence of various diseases in the recent past. So, there are research gaps which need a lot of intensive work to know how these diseases have emerged, how they have spread, and what could be the possible future. Then we have the requirement for improved diagnostics and vaccines, which is very much exemplified by the fact that so much of vaccine requirement for lumpy skin disease in cattle, many cattle are being affected. So, we have to have an immense stockpile and emergency stockpile available to address these diseases. Then there has to be a collaboration and cooperation between scientists, diagnosticians, industry and public. Then there has to be education, awareness and leadership on these issues, planned response and national preparedness. Now, India's preparedness is quite good, because we have been very impressive in tackling COVID-19 and also earlier transboundary diseases like avian flu. Then certain points still need consideration. A core group of scientists for strategic planning and implementation at the face of an incursion or at the face of a contingency is required. Immediate mobilization of teams, both regional and national. On-field supervision of activities by an expert group, more closer and cohesive interaction with central and state machinery, and we have to have provisions for compensation to farmers and mass awareness programs for general public like the one which we are doing today. And our entire system for tackling has been really enhanced, and we are in readiness, especially after COVID-19, the way it has been handled. If you look at the population of our country, the way we have handled this outbreak, the amount of vaccinations done, it is absolutely, I think, unthinkable in terms of resources, in terms of planning and in terms of the impact. So, no other country in the world has been able to successfully contain this disease as we have. And we need to establish more research or diagnostic labs across the country. Then we have to follow OIE and World Health Organization SOPs and policies with country specific changes, and develop more human resources for emergency operations, on border quarantine and testing facilities. So, these are some of the clinical pictures from the area where I was working. Like you can see that there was a bovine foot and mouth disease outbreak in a place called Umiam. Then there was a swine foot and mouth disease outbreak, which is again a matter of concern. Then the PRRS, which Dr. Gagan Gupta had mentioned. Then the PPR outbreak in southwest Garo Hills, contagious ecthyma. So, these are just meant to sensitize you towards how monitoring and outbreak investigations are important. We went, and even now at the shortest possible hint, we immediately go down to site and check out on the outbreaks. And this is the outbreak of enterotoxemia, bovine papilloma and suspected lumpy skin disease in goat and buffalo. And that's all. I'd like to conclude by telling that preparedness is the key. So, we have to be prepared, and preparedness is absolutely necessary. So, here you can see a picture of culling being done in the UK in order to contain foot and mouth disease, and earth movers being used to dump carcasses of cattle, and flames rising sky high due to these culling operations. And lastly, I would conclude by a quote from Carrot, where he said that today's mingling of people, animals and microbes in new animal or in new environments has no historical precedent. we all await the coming plague. And this was told as early as in 1984 or 87, I don't exactly remember, but it was proved uncannily true by COVID-19. So the amount of death, the amount of fatality, the amount of economic loss, COVID-19 changed it all. I mean, the entire world order, the behavior, the mask wearing, sanitizing, so much of consequences. So that's it. So unless we have a robust biosecurity plan in place, and unless we have strict surveillance, unless we have strict, monitoring measures, there could be many such more diseases in the future. Thank you so much.
Thank you so much, sir. It was a very detailed study, and we got to know a lot of things regarding the biosecurity and even India's preparedness for such things. So, I would like to ask you, could you please suggest a few more institutes where such studies are being done presently in India?
Well, the first institute will be the National Institute of High Security Animal Diseases, then Indian Veterinary Research Institute. We've got a lot of medical institutes working on it after COVID-19, like we have the National Center for Communicable Diseases, we have the National Institute of Virology, we have so many medical colleges who are tackling these aspects, and we have projects also. Especially there's a platform of on One Health involving 27 national partners, and this platform of One Health is actively concerned with surveillance and identification of diseases across the entire country. So platforms like the one that I just mentioned would help us in building a database and also ensure in monitoring real time for the perceptible threats and for the perceptible possibilities of any disease emerging or re-emerging.
Okay, so we can say that multiple scientists are working on the same, and we're trying to find the solutions of the infectious diseases that our animals, our biosecurity is facing. I would like to request all our viewers, if you have any questions, any queries, please give us a call on our number, which is 8800440559. Our guests are here till 11 o'clock, and we have a lot of time to raise your questions, to ask any doubts you have in your mind. And you're watching us on PM eVidya channel number 9, channel 10, channel 11 and channel number 12. So there are multiple email IDs also through which you can get in touch with us and raise your queries. And of course, our YouTube channel, that is NCRT Official, that is always there with you. So I have one more question, sir, to ask you. So biosecurity covers animals and plants, like we all know, but it's a very wide, huge category. So does it cover aquatic animals as well, and what about birds?
Yeah, they are all coming under the ambit of biosecurity, because what happens is that biosecurity refers to anything living and any threat arising from such, like even honeybees come under biosecurity, right? So whenever we go for exporting or importing any living organism, even microbes, there could be biosecurity issues which are linked to those. So that is why, as I told you, that there could be spillovers from labs, from research labs, or there could be risks coming due to importing animals. There could be risks due to, mishandling of these like organisms, hospital-based spillovers. For example, another very important aspect of biosecurity would be the hospital waste handling, because you know that several of the deadly multiple drug-resistant microorganisms which are being encountered in human health settings, if not properly disposed of, could lead to significant threats. So all these aspects are covered, and not only animals and plants, anything which is living in a strict sense would come under the ambit of biosecurity.
Okay, all right. And like you said, that it's a very a huge category, and all the living beings come in this category. So it's very important to spread awareness regarding the same, right? So would you like to recommend in spreading awareness on these issues for an institution, like an educational institution like NCRT and multiple others?
Yeah, I think that it should be a part of the curricula, and most of the research institutes have their institute biosafety committee. So the Institute Biosafety Committee is concerned with giving clearances on how to handle pathogens and how to, suitably measure the threat perception and employ suitable work environments which are best suited to minimize the risks with such pathogens. And NCERT could definitely play a role in promotion of biosecurity at the community level. That is through adoption of hygienic practices, sanitation, and the best example would be the 3 practices of masking up, maintaining social distance, and hand sterilization. So these 3 are basic fundamental, safeguards which were employed during the COVID-19 times. But very interesting fact is that the widespread adoption of these 3 practices have significantly reduced the other diseases.
Oh, that's good.
Okay.
Right?
Right.
So unknowingly, everyone did it for COVID-19, but the results were perceived in terms of reduction of diarrheal diseases, reduction of food poisoning cases, and reduction of other infections, right? So I think that this would be a classic example of how a simple practice could have far-reaching impact and could have a huge contribution in terms of attaining the overall health objectives of the population at large.
Absolutely. So you're saying these common basic practices should be followed by common man in regular days as well, right?
Well, yeah, to a certain extent, yes. But then what happens is that you have certain areas which are more prone.
Okay.
For example, suppose you have, water discharge points or sewers or places where you have landfills wherein a lot of waste is being dumped. So people living on those fringes, or suppose we look into the areas where there's a close border between the forest and human habitation. These are specific areas where there's a risk of spillover, and the spillover would be such that it would be very difficult to detect the first or the index case. So when the case buildup is there, then we get to know about it, and then we generally try to contain and control it. So instead of that, if these measures are adopted uniformly, considering the threat perception, then I think that incursion of such threats would be much more reduced.
Okay. So one more thing, apart from these 3 basic practices, what else can a common man, a regular man can do, to prevent, and what would be his role?
See, I think that cleanliness, hygiene, sanitation, safety, and overall health, these are all closely related.
Right.
So a common man can adopt cleanliness when it comes to his living environment, when it comes to the food that he takes, then also when he, when it comes to the practices that he adopts, in terms of, maintaining a decent and a clean environment, then washing eatables. So these are very common basic sanitary practices which everyone is familiar about. And then COVID-19 has been a game changer in teaching us the basic tenets of biosecurity. So the practice of masking up, maintaining social distance, then keeping hygiene, sanitation in mind. These are the basic requirements for ensuring a biosecure environment. And by continuing this, by ensuring that he doesn't dispose things carelessly, or doesn't go in breaking up the sanitation and hygiene chain, he can contribute significantly in enhancing the biosecurity and limiting the spread of pathogens.
Okay, so I'm sure all the viewers who are watching this program at this moment, they're going to follow the practices you just mentioned, and I think the future is going to be a lot more safer than we expected. Sir, would you like to?
Yes, so Dr. Sen, I was hearing to you a very interesting and very knowledgeable session we had. I have few queries.
Yeah, please.
I have few queries. You were talking about COVID-19 and the nature. Basically, see, you mentioned about that how the viruses and bacteria are coming into existence. So you hinted the processes within themselves, within these living organisms, like mutation of viruses, mutation of those organisms. So this broadly makes us to understand that these virus, as if that these viruses or bacteria affects all organisms almost in a similar way. Then how did it happen that the SARS virus affected human being a lot, but its variant into animals was not seen?
Yeah, that's a very interesting question, Dr. Gagan, because there are reports of COVID-19 being encountered in animals, okay, both in wild animals and, but the reports are far too sketchy, because COVID-19 was much more of a human disease than an animal disease, and mostly what happens is that you have particular viruses adapted to particular hosts, that is due to the receptor fidelity. That means if that particular receptor doesn't exist in an animal, then this particular virus would not be very successful in that animal. So that's why we are not being affected by lumpy skin disease or by foot and mouth, which is a cattle disease, right? But there are diseases which are much more broader, which affect a multiple number of species.
Like bird flu.
Yeah, and since COVID-19 is an emerging disease, there is all probability that it may adapt to a particular species of animals in the days to come. So I think that that is where we have to keep up our enhanced surveillance.
With this, if you see that the coronavirus, COVID-19 is rather new, as you explained it, that it is still emerging, but coronavirus is not new.
Yeah.
Yes, coronavirus is not new. So, did we see some kind of infection in animals or in aquatic animals?
Coronaviruses are present across many animal species, poultry. For example, infectious bronchitis virus, then you have the infectious canine hepatitis, the bovine coronavirus, canine coronavirus. These are established canine coronaviruses, but they are not as virulent or as threatening as COVID-19.
Yes, that has been.
But animal coronaviruses are very common.
But yes, we have a ray of hope that the new variants of coronavirus, either our bodies have adapted to it or have become slowly immunized to these kind of virus.
I think yes, because
or the virus is not that active.
Yeah, I mean transmissibility may be enhanced, but virulence is much more lower. But I think that we have to still maintain up to the biosecurity requirements, the COVID-19 precautions, because as the virus is mutating, you cannot predict that what the next mutant will be like.
So that's forever. That's forever.
I think for the next,
next. I mean, probably it will come into our blood or into our everyday life practice. That we need to be so vigilant about this.
We would definitely get over this, but it would require some more time.
To
till
get
such
it settled.
time we are convinced that this virus.
Now, Dr. Sen, I love the statement of Garrett which you mentioned towards the end of your session. We avoid being plague. Yes, we keep on. I am a student of physics, so we love mathematics as well in predicting the things. We do it for particle predictions, etc., in different other reasons. We tried making mathematical models for the spread of this COVID-19, but unfortunately, I mean, developing of mathematical models had the same aim, as you said, that we keep on awaiting the plague, and then as if some other variant becomes fatal or spreads so much, so how to handle it before. But those mathematical models largely failed. I mean, how do you see at this particular characteristic?
The mathematical model is basically based on the premise of two things. One is past events, and second is the character of that particular pathogen on which we are building the mathematical model. Yes. So in both the cases, COVID-19 was unpredictable, because no one knew that the Delta variant would be this virulent, and it would slowly go into the Omicron, which would be highly transmissible, but the virulence would come down. And then again, the effect of vaccination, mass vaccinations, the boosters, they have definitely helped us in controlling the disease to a large extent. But then what I would suggest is that we would love to work on refining these models based on the prior experience that we are gathering. And I think that in some cases the mathematical models are very successful in predicting the outcome of a pathogen and an outbreak.
Yes, particularly in a case of a single variant.
Yes.
For example, the kind of mathematical models which are predicted by either by Indian institutes or institutes outside. You talked about vaccines, etc. Vaccines, etc. a lot. As a common man, we see that the vaccines are there for either for viruses and for bacteria both. But the medication, probably in the case of animals too, in the case of human it is largely, I mean to a great extent these medicines are for treating bacterial infections. Very rarely we have medicines for viral infections. So it is assumed that as if even if we have viral infection, the medicines for bacterial infections are being prescribed to increase our immunity and to get the viral infection subsides on its own with due course of time. How do you see this phenomena? I mean, is there some problem in developing the medicines, or what is the characteristics of the virus that the medication is not so easy?
Yeah, see, antiviral medications are highly specific. For example, we have antiretroviral medications, we've got medications which are very effective in herpes cases, in cases of
in case of herpes,
yeah, acyclovir, which can be used, and these are specifically targeted to a particular group of virus. And when it comes to prescribing antibacterial medication, that is just as a safeguard, because any viral infection has the chances of a super infection by bacteria or by any such pathogen. So in order to deal with it, we go for antibiotic prescriptions and like other things, right? So the main problem behind developing a large scale or effective antiviral medication is that the viruses, they are basically genetic pathogens, means they've got very different mechanisms when it comes to bacteria, and the treatment options available for viruses are highly limited, looking into their nature and looking into their characteristics.
So this situation is similar in the case of animals too? Or
yeah, in animals it's exactly.
In the case of human we are seeing it.
Well, yes. We have much more lesser options in animals rather.
So one interesting thing is that when we started this series in 2021, we had Dr. Gagandeep Kang with us. She spoke about this virus, and at that time this COVID-19 was at its peak, the infection was at its peak, and we asked several questions to her. And then we are basically science students, so science के students का एक बहुत बड़ा काम होता है कि सपने देखता है, आँख खोलकर सपने देखता है, मैं भी सपने देखता हूँ. तो हमने उनसे भी सवाल पूछा था, but at that time this question was for limited with the COVID-19, but in general that we have vaccines for different diseases, rabies, rotavirus, etc., etc., etc. Are we going to, do we see a time in future timeline that when we can have a universal vaccine? So she mentioned about it. So are we really seeing a similar kind of picture of universal vaccine kind of thing in the case of animals too?
See, the main thing is that what is a universal vaccine? See, universal vaccine would be something, ideally speaking, a single product which would एक दवा हजार
मर्जों के लिए जी
तो
दवा नहीं ये तो रोग है
I mean so like whatever it is, but I think that a vaccine is basically specifically intended for a particular agent. Like if I expect that I'll get the protection against disease B using vaccination A, then I would be very wrong at this stage.
I see.
Now there is a concept of tailoring vaccines. Tailoring vaccines in the sense we can go for a chimeric build-up of various particular pathogens and then administer it. But then the vaccine technology is complicated, and the more complicated than that is the immune system. How the immune system accepts. Now whether the immune system accepts or not, how much of protection we get, what would be the duration of protection, whether that protection will take care of variants or not. So there are lots of questions. And
I mean the way a layman like me, as far as the subject is concerned, feels that anything which comes out in my body which is not usual, or to which my body is not already accustomed to, anything different, no matter whatsoever the variant it is, if there is some agent in my body which can stop that the spread of that kind of foreign body, let me say use the word foreign in that context, probably may lead to an answer of having universal vaccine or something like that.
Yeah, so that's a very important aspect you touched upon, Dr. Gagan, that is the concept of non-specific immunity.
Yes, non-specific, whatsoever.
Which is also called as the innate immunity. Innate immunity refers to the enhanced immunocompetence of a person to ward off any pathogen at the first level rather than promoting it. So that is one very interesting area, and I think that people are working on it, how to build up the innate immunity, which is not specific immunity in nature, but contributes in large measure to warding off pathogens or to stopping it at the first level. So that is one very important thing, and another very important thing which I would, which is my perception, is the relation between nutrition and immunity.
Yes, this is a difference.
Because this is a very grey area.
Yes.
Because we really don't know that what would be the contribution of the various nutrition factors in enhancing the immune response or the immune competence of like individuals, and we have seen this in case of the COVID-19 treatments, which used to prescribe drugs like ivermectin, then vitamin C, zincovit. I think that there's been a record sales. I mean, last 40 years में जितना बिका नहीं वो COVID-19 outbreak में बिका.
Particularly ivermectin.
And the worst thing is that these remedies were available off the counter, and you really don't know that how many kilograms of vitamin C a person took during those times, thinking that it would help him in preventing the outbreak of. So the thing is that we have to work on such aspects, and as you rightly told, that the innate immune system's contribution in enhancing the immune ability of any host, animal or human, is certainly important in the initial resistance offered to any pathogen.
Yes, very correct, very correct. और I mean हमारे सपनों को थोड़ी सी गति दिशा दिख रही है, हो सकता है कि आगे आने वाले दिनों में हमें मिले. Yes, you very rightly said that during this last 2 years we had seen the overconsumption of Ayurvedic medicines like carriage, etc.
Yeah.
And now we are having in our hospitals around the country, we are seeing that many patients are coming with the liver problems and gastroenteritis problems, etc., etc., because of over consuming these medicines. And many people started taking all those precautions, the so called precautions, on their own without having any doctor's prescription or doctor's understanding of it. You talked about emergency action plans, isolations of isolate new additions, etc. Then you talked about a lot about the need of dedicated research organizations, research systems. You talked about Bhopal laboratory called HSADL. I just forget the full name of it.
Now it is renamed as National Institute of High Security Animal Disease.
I see.
Earlier it was
HSADL. Okay.
Now it is National Institute of High Security Animal Disease.
Animal diseases. That's good. And then you talked about that this part of the globe, the SARC, the South Asian nations, which you mentioned about it. Largely, you are talking about SARC region, not including Indonesia or Fiji.
Yeah, Southeast Asian nations.
Southeast Asian,
China, Thailand.
So, okay, so for many other countries,
Bangladesh.
much beyond. So, what is special in this particular reason that these kind of things become so peculiar?
Yeah, that's a very interesting question. See, one very important thing about the Southeast Asian nations or the Far East is that we have a very dense population living in very constrained spaces. So that leads to multi-composite livestock farming. Like for example, suppose you have the tire-based system in Guangdong, China, wherein you have people rearing pigs, ducks, then poultry birds and other species in a houseboat which they inhabit, right? So this close animal-human contact of between various species.
So that's
acts like a mixing vessel,
Okay. I wish and I see that we request IVRI and research institutions, other research institutions to have more diagnostic labs, as you mentioned.
Yeah.
For animals too, we have diagnostic labs spread throughout city for human.
But we have a very good like animal diagnostic capabilities even now
in the country, but these are not spread through the country.
They are, and I think that there is more need to set up sample collection units from the state government side, so that laboratory competence is there, but we have to work further on it.
Okay, that's great listening to you, Dr. Arnab. My friend, you have enlightened my understanding on these biosecurity issues, no matter whether for animals or for humans. It was great listening to you. Tanvi, before we wrap up, let us just talk about the next program.
Yes.
So next viewers, our next session is due on 7th of October 2022. Friday, 10 to 11 a.m. same time, and this time we are going to have a very renowned speaker with us, Professor V. Subramaniam. He is formerly from Jawaharlal Nehru University, and he is now associated with the Department of Natural and Applied Sciences of the TERI, and he will be talking about biogeochemistry of rivers, Indian rivers particularly, and he will be talking about that what do our rivers carry. I am sure that we are going to have another very interesting session on 7th of October. Till then, thank you very much.
Thank you.
Thank you.
So much,
Thank
sir.
you.
Thank
Thank
you.
you. Thank you.
Thank you so much, Dr. Sen. And just like Sir said that he was enlightened by the understanding of biodiversity thanks to you, and it's not just him, our viewers and even me. We've got so much knowledge today on biosecurity, and the basic thing is that we all have a role to play. So the protocols we followed during COVID-19, we all need to follow, and if we'll follow it up, it'll be better for our upcoming generation. So thank you so much, sir, for being with us, for giving us your time and for sharing the knowledge with all our viewers. Thank you.
Thank you. Thank you so much.
And thank you to our coordinator, Dr. Gagan Gupta. Well, he's the brain behind this entire program. Without his hard work, this program wouldn't have been possible. Thank you so much, sir. Thank you.
Thank you.
And just like he said, our upcoming session would be on 7th of October. So please keep your questions ready. You already have the topic now. And of course, it is going to be interesting, yet another interesting session. So please watch it. Same platform, NCRT official and our DTH channels. And you can post your questions through our email IDs. There are multiple mediums through which you can connect with us. So we're wrapping up this program particularly here. Thank you so much for watching this program and enjoying this program. And if in case you have missed it, NCRT official, that is our YouTube channel, on which it is being uploaded. So you can watch it anytime you want later in life. Thank you once again. Take care. Namaskar.